Hi everyone. I'm here to talk to you today about the new announcement of the pause in using the J&J vaccine. It's a very disheartening development, but one that we're really grateful that we have people watching so closely over our vaccines. The FDA has recommended, not mandated, a pause on the distribution of the J&J vaccine. So we, the St. Clair County Health Department, will be following this recommendation and no longer be using the vaccine, the J&J vaccine, until it is reopened. So I just want to share with you that nationally, over 6.8 million doses of the J&J vaccine have been administered to people, and this decision was based on 6 cases of an unusual development of the cerebral thrombosis. So a very, very rare occurrence that has prompted this decision. So in St. Clair County, I also want you to know that we have given 31,000 doses of vaccine. Out of that, a little over 3,000 have been the J&J. So the vast majority of vaccine that's been used in this county has been the Moderna or Pfizer products. We still have plenty of Moderna and Pfizer products to continue our vaccination process. So our vaccine process is not going to be discontinued as a result of this decision. So the CDC and the FDA are reviewing the data involving these 6 reported cases. This is a rare and severe type of a blood clot in the cerebral vein area that developed in individuals within 14 days of receiving the vaccine. So in these cases, the blood clot is called the cerebral venous sinus thrombosis, and it's really a form of a stroke. So it was also seen in combination with low levels of platelet counts called thrombocytopenia, which makes this presentation a little unusual and which raised the alarm that something might be related. Remember, if something's related temporally in time, does not necessarily mean it's directly causal. But it was close enough that I think it is prudent for our researchers and scientists to really review this and make sure that this vaccine did not prompt this unfortunate condition. So all 6 of these cases did occur in women between the ages of 18 and 48. And as I mentioned, all the symptoms did develop within 14 days of the vaccination. What are the symptoms, you might ask? If you received a vaccine, what should you be worried about? Well, I mentioned this is a stroke-like event. It's not subtle. This is a very severe cerebral neurological event. It can present as very severe headaches, severe abdominal pain, dizziness, blurred vision, ringing in the ears, weakness on one side of your body. These are significant symptoms. So if you feel like you're having unusual symptoms, the appropriate thing is to call your healthcare provider and discuss it with them. What will be the treatment of something like this? Well, it would require hospitalization and a specific treatment of the clot that was occurring in that location of the brain. And of course, it would require CAT scans and different kinds of radiological studies to identify it. So I'm going to mention again, this is an extremely rare condition, and that the issue of halting this vaccine is out of abundance of caution. By the way, there was no link between these individuals and using oral contraceptives or birth control pills. So please don't discontinue your birth control at this time, even if you've received the J&J vaccine. So something that comes up is people want to know with this concern, is the vaccine still effective? And it absolutely still is effective. So if you did receive the Johnson & Johnson vaccine, know that you are receiving all the benefits of preventing severe infection and death that come along with that vaccine. So the vaccine is still effective. We're just pausing it to be absolutely certain, out of the abundance of caution, that it's not increasing any risk for this condition. I want to just share with you another component of this. I think it's important to remember. This connection between the J&J vaccine and these 6 cases was identified because of the very robust and fantastic post-marketing surveillance system that we have in the United States to monitor vaccines in particular and make sure that there are no unintended issues occurring as a result of using them. And this level of concern is because we give vaccines to healthy people to avoid illness, which is different than using medications to treat non-healthy people. So there's a higher standard that we want to hold vaccines to. And this system worked. In this case, it identified an exceedingly rare event and did it very, very quickly so the vaccine could be held and studied more closely. This is exactly what we want the system to do. You compare the fact that 6.8 million doses of the J&J vaccine was used to close to 180, maybe even more than 180 million doses of the mRNA vaccines, the Pfizer and Moderna vaccine. And in those two cases, the other two vaccines, we have not seen any signals in the surveillance systems that would indicate there is a health concern. That to me is very reassuring. And I want people to know that this vaccines that we're using are being watched very carefully and that you are still in very good shape to receive the other two vaccines. They still are exceedingly safe from the information that we're continuing to gather since we started using it. So please continue to vaccinate. The risk of COVID disease and infection far, far exceeds the risk of any vaccine that we have currently available. And especially now during this surge, it's really important to protect yourself and those around you.